March the 9th, 2025. A day of reflection, set aside to remember the friends and loved ones lost to COVID and the sacrifices that we all made. Remember? Of course we do. But do not betray those who every day bear the consequences of a flawed vaccine rollout. The vaccine injured have been marginalized, even scorned by the medical profession, the media, politicians, the very people who persuaded them to take the jabs in the first place. They hoped that the COVID inquiry will provide answers, some truth on which to build. Instead, they met a familiar brick wall.
What we cannot do is make precise determinations in relation to whether a specific vaccine is safe, or determining matters of causation where death or injury has resulted from specific vaccines. Safety is a relative concept, and any determination, if it could be made, would serve no sensible purpose.
It's outrageous what's happened with the UK COVID inquiry. It's turning into a whitewash and a complete waste of public money.
Many issues could and should have been addressed. Not least, were the public deceived over millions of AstraZeneca jabs which were actually a relabeled Indian-made brand, Covishield, close to the expiry date? We'll investigate that shortly. In any event, the outcomes of Baroness Hallett's inquiry seemed predetermined. Here's the lead counsel speaking before any evidence had been heard.
The absolutely clear expert opinion of the leading pharmacoepidemiologist instructed by the inquiry, Professor Prieto Alhambra, from whom we'll of course hear in due course, is that the vaccines, those 3 COVID-19 vaccines, were entirely effective.
It's not really acting as an inquiry at all. The barristers have to submit their questions in advance, and they're told that they're not allowed to ask some of them. And then on top of that, when witnesses are raising really important issues, the barristers are shutting them down and not letting them speak. And the vaccine injured have just been deliberately excluded from the conversation.
As a consequence, nobody was able to question that oft-repeated mantra that side effects were very rare despite the unexplained increase in sudden deaths. Nor could they challenge the spurious claims of success.
The United Kingdom Health Security Agency further estimated in September 22 that by September 21, a year earlier, 9 months after the rollout had begun, the COVID-19 vaccines had prevented more than 23 million infections and 123,000 deaths in the United Kingdom.
The claim that these products reduced infections was not based on evidence. And in fact, it's not only that they didn't reduce infections, they never could have done, because what these products do is produce antibodies in the blood. And what you need to stop an infection on the surface of your lungs is antibodies on the surface of your lungs, which these products did not produce. There wasn't any reduction in transmission either. And so they pivoted to saying it reduced severe diseases and deaths. But in reality, those claims were based on computer models with false assumptions, saying there'd be a huge tsunami of deaths that never would have occurred. If you make up some number to say this is what would have happened, and of course you can claim that you saved millions of lives, but it's a baseless claim.
The vaccine injured see the stain of a cover-up rather than a forensic search for the truth. And still, there is a disgracefully short list of names who've received compensation for vaccine injury. Usually the bereaved, like Charlotte Wright, whose husband, Stephen, a brilliant child psychologist, died at the age of 32. Or the severely injured, like Alex Mitchell, who lost a leg and very nearly his life. But thousands of others who experienced dramatic life changes immediately after taking the jab cannot get medical confirmation, let alone prove the 60% disability threshold for payment. Colin Wilkes is one. He was a fit and active 56-year-old living in Cornwall, and with his wife Julie enjoyed the outdoor life. Within days of a single AstraZeneca jab, he began having multiple seizures.
At the beginning, they were extremely frightening. Wasn't sure really what was happening to him. As you can see, he's got this tremor, which is very apparent, visible. So it's massively impacted his quality to his life than what we had before. I've become more of a carer than an actual wife.
It makes me feel guilty for being like this, to be honest. Oh. So the things that she can't do now, that, you know, because she's here with me a lot and stuff, that makes me feel guilty.
Colin had worked as a valet and driver of luxury cars, an impossible situation for a man with his condition.
The only outcome of that was I had to be sacked, basically.
They dismissed you on medical grounds.
Dismissed on medical grounds, yeah.
With Colin virtually housebound with no income, the Wilks had to borrow money to avoid losing their home before Colin eventually received disability benefits. He's been diagnosed with functional neurological disease, but doctors still refuse to link it to the jab.
Nobody wants to listen to our stories. Every source that we've tried to get our story out there, it's just been shut down.
Now, I'm very angry towards the government. I feel they've let a lot of people down.
Betrayed.
And I think it's about time that they came clean.
What Colin Wilks didn't know was that the shot that he'd received, which he thought was British, was actually made in India and had been stockpiled for months before it went into his arm. His batch number was 4120Z003, which was responsible for a reported 7,511 adverse reactions and 18 deaths. That's more than any other AstraZeneca batch in the UK, according to MHRA figures obtained through a Freedom of Information request. Furthermore, its sister Indian batches 001 and 002 were also in the worst 5. Between these 3 batches alone, there were 19,575 reported reactions and no fewer than 54 UK deaths. And the real numbers are likely to be much higher, because, historically, only a fraction of cases are reported. The 3 batches were made by the Serum Institute, the largest vaccine manufacturer in the world. From May 2020, the Serum Institute, or SII, had begun a partnership with AstraZeneca for COVID vaccine development, with Oxford AZ providing the technology, virus seed, and cell banks. Based on this, the SII produced the brand Covishield, and millions of doses would later be administered across the world, including from the aforementioned 3 batches. Records from India's National Control Laboratory show that these batches were manufactured in October 2020, in anticipation of regulatory approval. Note the expiry dates: March and April 2021. Meanwhile, the first AstraZeneca vaccines, later to be called Vaxzevria, were approved in the UK on December 30th, 2020. The rollout began 5 days later, using British-made consignments. The campaign to drive all COVID vaccines was both relentless and persuasive.
What a difference a day makes. 24 little hours brought the sun and the flowers where there used to be rain.
One step ahead of me.
A day makes.
Just a sharp
There's a rainbow before me.
That's it.
Not bad at all.
Skies
I got it done.
Can't be stormy.
Would you like a red or blue one?
Since the moment
Thank you for coming.
Biggest turnout of the season.
Join the millions already vaccinated. To protect yourself and others, you need 2 doses for maximum protection.
Demand for AstraZeneca jabs was high, so, as confirmed by the government website, the 3 vaccine batches 4120Z001, 002 and 003 were imported from India and were assessed and treated as COVID-19 vaccine AstraZeneca. The sheer volume of adverse reactions from 3 imported batches should absolutely have been worthy of investigation. And there had been concerns, as official documents show. On February the 15th, 2021, the Medicines and Healthcare Products Regulatory Agency, MHRA, made a presentation on the batches to the Commission on Human Medicines Expert Working Group, EWG. The minutes include the following excerpts.
AstraZeneca has transferred manufacturing process and key analytical methods to SII. There have been some changes to manufacturing, however, with no material effect to the product. The EWG heard that manufacturing and testing of the seeds banks appear largely acceptable, but some questions are raised re methods, validation, missing reports. Questions have also been raised concerning testing for adventitious agents. Currently, limited stability data is available for the drug product. The batches were manufactured in October 2020, and therefore MHRA would require additional assurance over stability before these batches can be accepted with a less than 6-month shelf life.
On that point, the EWG asked why these batches were available, when countries like India would have a great need for vaccines.
The EWG was informed by MHRA-LD that the batches were coming to the end of their shelf life and run the risk of going out of date. It was considered that the UK, more so than others, have the logistics to deploy them quickly.
It seems that all of these issues were resolved at speed. The Serum Institute provided a robust corrective action plan on February the 19th, according to evidence given by the head of the MHRA, Dame June Rain. The MHRA could therefore implement what it had told the EWG.
If all the RFIs, requests for information, are resolved, some immediately, some as a commitment, these batches could be approved and labelled as AZ batches. In summary, there are no concerns about the safety of Covishield and its reactogenicity as broadly comparable to that of AZD1222.
Accordingly, a certificate was issued on March the 3rd, and 2 days later, a consignment arrived in the UK, as posted on Twitter by India's External Affairs Minister. And within less than a week, 4.5 million doses were deployed across the UK. Alex Mitchell received his single dose on March the 20th and collapsed with multiple blood clots within days. Colin Wilkes was jabbed on March 27th. Nobody who received the jabs knew they were getting Indian-made Covishield. This is an example of a patient's documentation, clearly stating the manufacturer as AstraZeneca instead of the Serum Institute. The product is named as Vaxzevria. The batch, 4120Z001, and the date, March the 12th, 2021. And NHS documents state, the government has confirmed that no Covishield vaccines have been administered in the UK.
One of the fundamental issues throughout this whole thing has been informed consent, and it was trashed in 3 different ways. So first of all, the environment of fear was created such that people weren't thinking rationally, and then they were told what were frank lies about the products that could never have been true, and lastly, they were actively coerced. And of course, giving people one product while telling them it's another one is simply fraud and can't be defended at all.
So why were the doses relabeled as AstraZeneca? The shocking truth is that the brand Covishield was not licensed in the UK and never has been. We didn't even recognize Covishield as a valid vaccination for travel, even from India, until months later. The government line is that AstraZeneca and Covishield are one and the same vaccine. But how can they be identical products when the MHRA itself uses terms like changes to manufacturing, largely acceptable, broadly comparable, and when the 2 versions were made thousands of miles apart?
Well, it can't. If they're made by different companies with different processes, different manufacturing processes, they're going to be different products. There's a mantra in the industry that says the process is the product. Everyone knows this in biologics. Every process produces a different product because these are so sensitive to the vessels they're made in, the tubing used to transfer them into different vessels, and temperature conditions, all sorts of different aspects. So they cannot claim that. The other question is about MHRA claiming they tested these injections. That's impossible because the companies themselves have to test these products. What MHRA have to do is visit these companies, examine their processes and make sure they are capable of testing to the right standards. It beggars belief that both AstraZeneca and the MHRA take such a cavalier approach to patient safety.
There are many more questions. Did the MHRA rely solely on the Serum Institute's own implementation of the robust corrective action plan? How robust were any checks? How were these corrections applied to 3 batches manufactured almost 5 months earlier? Were the batches independently tested after the MHRA's concerns were answered? If so, when and where? How significant were the approaching expiry dates? And did the MHRA see any correlation between the batches and the high volume of adverse reactions? If not, why not? It seems these subjects are beyond the remit of Baroness Hallett's inquiry. So don't expect any answers when she publishes her report in the months and years to come. And unfortunately, the Covishield story is part of a much wider issue. All COVID vaccines administered in the UK have produced side effects which are far more common than the authorities would have us believe. And while AstraZeneca has finally withdrawn its product, many physicians fear ongoing health problems, particularly from Pfizer and Moderna mRNA jabs. So, as we reflect on the consequences of COVID-19, let's pray that future investigations dig deeper than the stilted Hallett inquiry, perfectly summed up by Dr. Andrew Bamji in the Daily Skeptic. An inquiry led by the wrong experts, lawyers, asking the wrong questions of the wrong experts, mainly politicians, civil servants and non-clinical doctors, is not only ignoring medical and scientific evidence, but, by the way it limits witnesses, actively suppressing it.